Welcome, everyone, to the Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy counselor, and I'm joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
Doing pretty good, Amy. How you doing today?
I'm good.
That's good. What are we talking about?
Today, we are talking about fat.
I feel like we should have Salt and Pepper say, let's talk about,
Fat
baby.
Yeah.
So, we're going to have like a full-on discussion. Is this a serious conversation?
This is a serious conversation.
Good.
It is. A lot of what we do involves fat or the lack of fat. So liposuction is the thing that most people probably think about when they hear, let's talk about fat. They think about the fat that they don't like, but we're going to talk about that. We're also going to talk about why you should kind of love your fat.
Fat's good.
That is good.
So what's the first thing you said to me? And I was like, I don't know if she's right. You said fat's an organ?
Yes.
And it definitely is an organ. So you're correct. In medical school, when you're learning about fat, it's just kind of like a secondary discussion. They're like, oh, adipose cells, blah, blah, blah. There's a few cancers that come from fat cells. You talk about soft tissue disease like sarcomas and certain types of things, but really there's not a lot of time spent on fat.
Right.
And even when I was going through plastic surgery training,
they talked about fat in a totally different way.
No, there was no metabolic discussion of fat.
No,
they were
how do we
like,
get rid of it?
If you have fat, this is how you get rid of it. If you don't have fat, this is how you re-inject it. So we're going to talk today about liposuction, but more importantly, and hopefully this is useful for everyone listening, is we're going to talk about fat. And you know what? We don't know a lot about fat.
But we're learning.
But we are learning. So we're kind of in that stage now where we're starting to understand the fat may be one of the more important organs in your body.
Yes. So let's first talk about liposuction. So where does the fat go? So before you say anything about this, I get asked this question a lot.
I personally have no idea where it goes because I suck it out and then walk out of the room.
Exactly.
So, all right.
So it's left to me to deal with the fat that's left over, and people ask like what we do with it. I think a lot of people.
You tell the young kids that it doesn't die. It goes to a happy place.
Right. Yeah. Yeah. It goes to a fat farm.
Where it lives with all the other fat.
Yeah. People in our age group automatically think about Fight Club.
Oh yeah.
That we're gonna refine it down and make soap.
Yep.
So, once the jokes aside, like I'm gonna boil it down and make fat with it, sell it for like $20 a bar. Really, where the fat goes when we liposuction it, the fat goes in medical waste. It's trash. So that's what I like about.
And then what happens to medical waste?
It's incinerated.
All right, so they burn it.
They burn it.
Yeah, obviously for infectious disease reasons, because you don't know what could be in that fat.
Right. Well, and they don't. When they come pick it up, they don't know that it's fat. They just know that it's medical waste.
Mm-hmm.
So yeah, but it leads to an interesting question, which usually follows with, well, my friend's mom had liposuction on her stomach, and then she got a really fat neck. I hear this all the time. Why the fat goes to the neck, I don't know in these scenarios, but the assumption for people is that if you take fat away, that somehow this fat will like migrate to other parts of your body.
Yeah, because fat gets really pissed off, and it's like, listen, you took away my cousin, we're going to blank this up right now. We're going to go to this woman's neck, we're going to get fat in the neck, and we're going to make her look like crap.
Right.
That's basically what happens.
And I usually follow that up with, did your best friend's mom also gain 20 pounds?
Of
and
course
the answer
did.
is always yes.
Because what have we talked about with Dr. Matt Metz and everything we talk about weight and diet? It's pretty ineffective, and surgery or liposuction does not equal a diet. So people still fluctuate in weight. Mm-hmm. And then obviously as people get older in the 5th, 6th, 7th, and 8th decades of life, it's harder to keep the fat off. So if you've had liposuction historically, and then 10 years later, you're 10 or 20 pounds heavier, of course you're going to show signs of obesity in other areas.
Right. And I think that's really the key there is that when we take fat out, like you suck it out, peace out, and I deal with it. But all you've done is reduce the amount of fat in an area, which is the goal of body contouring.
Subcutaneous fat.
Yes, SC fat.
Underneath the skin.
So you're reducing the amount of fat. You're not reducing the ability of your body to gain weight. So the difference being that if you have like a jar of 100 marbles and you take 90 of those marbles out, the 10 that are left can still get bigger, but a jar that still has 100 marbles, if they're all getting bigger, that jar is going to overflow a lot quicker than the jar with now that only has 10.
Right. So this is start from, by the way, you can follow this on our YouTube channel, Jason Martin MD, which we have all these slides, which are actually really good. But let's just start with something we've talked about before. So we have talked or discussed that theoretically we were born with a finite number of fat cells, correct?
That is the still mostly accepted theory that by puberty, your fat cell number is pretty much set. And we didn't used to think that fat cells could be your body could make other cells turn into fat cells, but we kind of now know that that's maybe not entirely true.
Okay.
But from a basic metabolic, normal, healthy person standpoint, yes, like at puberty, the number of fat cells in your body is pretty much set.
So we'll just make that a truth, but we don't actually totally know the answer. So let's just say it's 10 trillion fat cells, okay? When we gain weight, do the number of fat cells increase in most cases?
No.
Okay. So what happens exactly?
Your fat cells get bigger. They can grow up to like 300 times in size.
Right. And that would make, like, what was the guy from Austin Powers? It was like a fat Austin Powers, the Irish guy.
You really want me to say it?
Yeah, yeah.
This is Fat Bastard.
Okay, fat bastard. So the fat cells become fat bastards. Anyways, the fat cells get bigger and they can grow really, really large. So that's why, and that's by design, from evolution, the fat cells are made for what, Amy? What is their primary, what is one of their big functions?
Energy.
You're right. And to store energy, they store it as fat. And fatty acids can be used for creation of ATP, which is what we use for energy in our body.
Yep.
So if
thermoregulation.
Everything. So fat basically is, as a result of evolution, is a way for us to survive in starvation states. And our body it doesn't matter if you believe in evolution or not, we're just going to take this as truth. Our body is pre-programmed to store fat for times of starvation. So you're born with a finite number of fat cells. When you gain weight, the fat cells get bigger, et cetera, et cetera. When we do liposuction, what happens, Amy? What do we remove?
We remove fat cells.
Okay. And this is say if you have 10 trillion fat cells, we removed 500,000 or something, or 1 million or something. Not a lot, right? But we in the whole grand scheme of things, but enough to make a difference. Mm-hmm. And when we gain weight again, in the area that we remove the fat, it has a tendency to scar down, and there's less fat cells there. So if you remove fat on your flanks or your stomach or your arms or your inner thighs, there's less number of fat cells there to get big when you gain weight. Well, we didn't do anything to your neck, okay? So when you gain weight, the fat cells there are all the same that were there before. They're going to increase in size like normal. Another thing in the surgical area, you form scar tissue, and they have shown this, that the fat cells don't grow in areas of scar tissue as well. They can't expand because there's like this fibrous network of scar around it that traps it in. So you have less number of fat cells in the area you liposuctioned, you have scar tissue, and that's why you really don't form fat in the area when you gain weight again after surgery.
Yeah, unless the weight gain is pretty extreme. And also, most of the time, liposuction should be done on healthy weight patients, meaning you're at a sustainable or a maintainable body weight. And
so is this where you make an Ohio joke? Because
no, this is not where I make an Ohio
the corn
joke.
fused.
No.
I'm from Kentucky. I just want to say that in certain parts of the country, a normal weight is different than Colorado.
That's why I said a maintainable weight. So your healthy weight,
Great.
meaning your maintainable
where you
weight.
don't have diabetes and high blood pressure.
Yes.
And that you're non-smoking and you're a healthy person.
Right. Your
Gotcha.
weight doesn't fluctuate more than 5% of your total body mass in less than 6 months,
Gotcha.
let's say, to really nail it down. But if you're kind of, everybody has that kind of thing in their mind that they use as a marker for how they're doing, right? Like, well, my pants still fit. Well, if where you gain fat historically is around your waist and you have liposuction around your waist, you may not notice that creep of weight because you're not seeing it where you normally see it until all of a sudden maybe you've gained 10 pounds but don't really realize it because you're not seeing it in your waist, your pants still fit, but oh my gosh, all of a sudden your shirts are tight. Your arms look fat. So
the fat creep.
Right.
Like TLC creep.
The creep. Yeah. We're just all over. We're going to use all the TLC songs today. There's going to be some waterfall stuff happening here soon, too.
Oh, gosh.
So you have to think about those things, too. So people who were using, perhaps that was the way they would kind of monitor how they were doing.
Yeah.
They weren't maybe measuring or weighing themselves, which is totally fine. That they may not pick up on that subtle creep as quickly because the area that used to really show that creep, like where you like to store fat, if you had that fat reduced, it's not going to show it as quickly.
Right. And we've talked about this before, and we definitely talked about this in the clinic. Fat distribution is many times hormonally driven. So you'll see primarily in women, they get fat in areas that men don't, and vice versa. A lot of men get fat, visceral fat. So women are like, I wish I was like my husband. He doesn't have this fat over the side of his jeans. The dude has fat all up around his organs, which is the worst kind of fat you can have. It's very inflammatory, causes heart disease. Like, you don't want that fat.
Right. Well,
that's why men have a higher tendency to get heart disease than women. That's not the primary reason, but one of the reasons.
Yeah, the different variations and where their fat deposits. And it's somewhat of a hereditary thing as well. Where you kind of store fat. I mean, we've seen it. We've had patients who come in who are maybe even underweight overall, but they have like an unusual amount of fat on their arms.
Oh yeah, or their inner thighs.
Right, which
we see it all the time.
And doesn't fit with the rest of their physique
Actually,
or the rest of their body.
saddlebags is the big one.
Yeah.
You see that all the time. These skinny women come in and they have these big saddlebags. It's like, this is so weird.
And they're underweight. Like they're like below a healthy weight, but they still have like a weird area where they collect fat. So, that's where liposuction is great because it's not going to reduce your overall body weight. It's really going to contour out areas where you might be storing fat abnormally or just hormonally, whatever the case may be. But it will not give you a fat neck.
It won't.
No.
I challenge anyone to give me a scientific article that shows that you get a fat neck from liposuction.
I've done a lot of research on liposuction.
Someone's going to come with some weird journal, It's going to be like handwritten. Like, here's the article.
Here's the article. Yeah, and these patients have to be weight managed too, so they cannot have gained a significant amount of weight. So you can't have gained more than 5% of your total
I would
body
highly
weight.
advise people not to talk to Amy about any weight loss or weight gain study that's related to diet and exercise, because you get so lost in the weeds on that. It's so difficult to equal out everything if you're studying a group of people when it comes to diet, exercise,
correct,
and surgery,
and anything,
and
lifespan
fat distribution.
even.
I know.
Yeah, that really is. And Dr. Martin's using the word diet, meaning the food you eat, not like being on a diet.
Not on a diet, excuse me.
Which is, and that's what's so hard too. We're so
programmed
in our society to believe that the word diet means that you're actually trying to lose weight.
Diet.
Right.
Yeah.
And to me, diet is just the food you're eating. So we use that word differently here. So yes. One of the things that we're going to talk about now is my favorite topic, is that fat is an organ. It is.
I know.
So when I was in school for nutrition.
I vividly remember this first conversation. You're like, fat's an organ. I was like, it's not really. It's just, superficial distribution. She's like, it really is. I went home and like Googled fat is an organ. It was like, oh yeah, fat's an organ.
It really is.
Here I am.
And why is that?
World-renowned physician.
Well, it's because these are new things. And
this was not, when I was going through medical training, we did not consider fat an organ. I mean, maybe they were talking about that, but that's not something that they taught.
No, and this slide really shows it. And again, if you'd like to see these slides, they will be up on our YouTube channel at Jason Martin MD. Shows the progression of where we're at with understanding really even the functions of fat. Because truthfully, before 1994, people probably had hypotheses that fat did certain things, but it had not been.
That's right at the peak of TLC's, popularity. I just want to say.
Don't go chasing adipocytes.
Yeah. Okay.
So, really until even the late 90s, early 2000s, what we knew that fat was doing was still very minimal. But we're learning so much, and that's really the classification of an organ versus non-organ is really the functionality of it. So an organ is a signaling thing. Like it tells your body to do things. It can receive signals. So it has an active function in the health of your body.
Right. And so we're not experts at this stuff. So if you want to get into this, there's people that really, this is their life's work.
Right. Like a lipidemiologist is
awesome.
Way more.
With that said, we know a lot more about this than maybe even the average physician because it affects our practice. And Amy and I are both very inquisitive, and we like to look these kind of things up because, I've had this thought, like I'm doing liposuction on people. Am I helping them in any other way besides just contouring their body? And does it have a negative effect in the future? I've looked this up personally. Mm-hmm. So understand that fat is primarily a storage of energy. It's a site that you store stuff. Just imagine like storing boxes in some storage facility. It's the same thing that fat does all over your body. But it also does a lot of other things. And we know that. And we've known that for a while because of something that's very common in this country, which is type 2 diabetes. Type 2 diabetes is like 100% correlated with people's body fat percentage and obesity. Now, there are people that can be very obese and not have type 2 diabetes, but in a high percentage of cases, if you are obese or morbidly obese, there's your incidence of type 2 diabetes goes way up. And so they've known that somehow the fat is affecting the sensitivity of our body to insulin. And the insulin, which takes the glucose out of your blood and puts it into your cells, is not either working as well, or that process breaks down. So we've known that it does have some effect on the body itself besides just storing energy.
Correct.
But that is the beginning. And now we're getting to a point where we see that it's releasing cytokines and hormones. It's interacting with your body. It's signaling so many different things. And if you look at the slide on our YouTube channel, you can really see this, and it's pretty amazing. And the other part of this is that we're learning now, within the past couple of years, that fat has an amazing array of functions.
It does. And there's also multiple types there's two main types of fat cells, not just talking about where they distribute themselves, like meaning visceral or subcutaneous fat. Like we also know now that they're...
Visceral means around the organs, subcutaneous underneath the skin. Why am I the translating person now?
We already talked about those two things, though. We already said this.
Oh, we did?
We did.
Okay.
Yeah, we already
I was
talked
totally
about
paying
those two
attention.
things. Yeah, you actually talked about visceral fat.
Oh, I did?
Already,
Okay,
yes,
good.
and we talked about
Did I say the word
subcutaneous fat.
visceral?
You did.
Oh.
Around the organs. Yes. You even described it. Yes.
Got it.
So our listener base listens.
They do.
They
They're
don't
very
need us to tell them
educated. They're
again.
very educated.
Yes. But the brown fat cells have a slightly different function and a different. They are actually really beneficial. And the more brown fat cells you have, in some cases, the better your metabolism functions. White fat cells, on the other hand, they do a lot of other things, but they can have a negative impact as well, like talking about things like type 2 diabetes. And
one of the big things, and I want you to go into this with fat, is inflammation, right?
Mm-hmm. And that's specifically where you were talking about before, like fat can increase your blood pressure. And why is that? It's because fat cells release a certain type of hormone. They're releasing hormones that basically constrict around blood cells. And that reduces the ability of those blood vessels to expand. So it raises blood pressure because of the inflammation that it causes around blood vessels.
Right. Because of the vasoconstriction.
Mm-hmm. Well, it causes it basically is almost like a little cast. Like it causes inflammation right around that blood vessel.
Yeah, I mean, vasoconstriction is constrict.
Yeah.
I mean, it doesn't mean the process.
Well, no, I'm just
Gotcha.
Nancy, I'm trying to explain.
Gotcha. So inflammation is what we're finding out is really the big problem in all this stuff. That's inflammation is what leads to aging in many cases. Mm-hmm. Inflammation leads to chronic disease like diabetes, like high blood pressure. It's really the main insult that we deal with, especially in America where we struggle with obesity. So if we know that fat is involved in this inflammatory process, it's very complicated and we're just understanding the beginnings of how this works. If you remove fat, does inflammation go down?
Remove fat from the body. And that actually is one of the studies that has been done, is to see if...
So when I do liposuction, am I reducing inflammation in people's bodies? We've had someone come to us who had a family history of type 2 diabetes. Everybody in her family had type 2 diabetes, which is interesting. But by the way, type 2 diabetes tends to be the one you inherit. Type 1 is the one that they believe comes from insults when you're a fetus.
Mm-hmm. You're born with,
viral infections and stuff like that. But now I don't know, I think that's changing too. So is it possible when we do liposuction that I'm helping them control the possibility of them reducing the chance that they'll develop type 2 diabetes?
So the two studies that are actually a little bit more well done in regard to liposuction, and it's really challenging. As challenging as it is to study the diet of humans, it's as challenging ethically to study the effect of surgery on populations, specifically when it could have a positive or negative outcome. That's why a lot of these things, research is still done on animals. But there are a couple of studies that were done on humans. There are small groups of humans. We're looking specifically at lowering cardiovascular related things with fat, and also with diabetes, like can you do really lower blood sugars? And
did it look like inflammatory markers like CRP and stuff?
So those go up immediately after surgery, but they all normalize.
Okay.
And the cardioprotective...
And they don't go down from baseline?
No,
okay.
They go back. The cardioprotective study showed maybe that there might be some benefit. Insulin remained the same. Now, again, these are challenging studies to say are definitive.
Like 40 people?
Right. Well, the one with insulin sensitivity, they were people that were overweight. So they were not normal weight. So they were overweight anyway. Their weight didn't change because, remember, liposuction is not weight loss surgery. But
why you got to ruin that myth?
I know.
That gets us so many patients.
Right.
I can't wait to lose weight when Dr. Martin sucks it all
right.
out.
How much less am I going to weigh tomorrow? And they get on the scale the next day because of inflammation. They weigh 10 pounds more and they call me crying. Yeah. So
I don't get those phone calls.
So it does, the studies that are really interesting with liposuction, which are even harder to do, are the ones that look at people like long term. Like 10 years later, did this provide any benefit to you? And there's very few of those, but the ones that do exist show that there's really not a large correlation. Again, they're very tiny studies.
Right. And there's to be honest with you, I'm not sure there would be, right? Because your body is very complex. It probably reacts when you remove the fat cells. There's some theory that you grow back fat cells, and that's why you would grow some in the neck, like that. You go to a homeostatic level or number, and I'm not sure.
Those studies, though, are very specific. So it's really interesting. The studies that show that fat can regrow in humans. Now, this does, of course, happen in animals, especially animals that hibernate. They have different ways of regulating fat than humans have.
Right.
So
which is why they can hibernate. Have you ever wondered why a bear can hibernate? It's because they have crazy fat skills.
Yes. And same thing with even small rodents. So the rodents that they do these tests on, I mean, they are done humanely.
Small rodents hibernate?
Yeah.
Really?
Yes.
Okay.
Yeah. Where do you think they all go in the winter? Where do you think the mice go in the winter? You think they all just die?
Whatever, Mills. You're acting like you know about small rodents.
Yeah. But they'll do the studies that have been done. They do a lipectomy, basically removing large chunks of fat, and they find that the animals are cyclical. So the next time they're ready for a hibernation cycle, they'll match the fat of other animals with the same activity, the same food. So they're not eating more, they're not exercising less. They're literally just as active and just as fed as their, non-adjusted peers, but they still gain the right amount of fat for hibernation. So that's different. People don't have that ability. But they have done studies on specifically visceral fat after liposuction and have found specifically in people that do not follow any type of exercise after surgery. And this means the exercise that these people do was walking and light resistance training. It was by no means a heavy duty or contest prepping. They weren't doing hours of cardio. They were walking 30 minutes a day and doing 3 lightweight training sessions a week. If they did that, and these people all maintained their body weight. The people who didn't work out before, didn't work out after, kept their body weight. The people who didn't work out before but worked out after, still, they weren't working out enough to lose weight essentially. But those people did not gain visceral fat. The people who did not do any exercise following surgery did gain an equal amount of visceral fat to equal the amount that was extracted from subcutaneous fat.
That's kind of spooky.
That's disturbing, right? And that study, again, has only been done once. But the cool thing is that they kind of piggybacked on that study. So they took that same study 10 years later and followed these people and measured other things on them, like their insulin sensitivity, their glucose levels.
And what'd they find?
And inflammation. And they found that those things were all stable as well.
Okay.
So whether they were exercised or not, they were not looking at visceral fat.
Whatever that liposuction change that maybe had a negative effect was only short-lived.
Right, but they did not remeasure visceral fat. So you would assume then that those people who did regain the visceral fat probably kept it, and the people who didn't probably didn't.
That's so interesting.
It's so fascinating. And I have long said, from the very first time that we did smart lipo. So smart lipo was a laser-assisted lipolysis.
It's very intelligent.
Yeah, it's very smart. It's about the size of a small elephant and weighs about 300 pounds. So, but it uses a laser to melt fat.
That's called laser-assisted lipolysis, and we use the triplex, which has 3 different laser wavelengths that would melt the fat and tighten the skin. This is before body tight or radio frequency assisted lipolysis.
Yeah, so it was powerful, right? This laser, you could see it under the skin. It was crazy. And yes, we do aspirate after, so we're sucking out all of this melted fat. But in my mind, I'm like, oh my gosh, what if you took the cholesterol levels of this person the day before surgery and then the day after? Because we suck out a lot, but there's going to be byproducts of these broken down fat cells that have got to be circulating in their body.
It would go up.
Right. And I've been I've always wanted to do that. And there are studies that do look at cholesterol levels.
Transient
yes. And it's
increases. It doesn't matter.
And it's transient. It goes back down. So the things you definitely see in testing laboratory values on a person right after liposuction are increase in inflammation, right? Any of your markers of inflammatory markers are going to go way up. Your cholesterol does elevate slightly. And that makes sense because your body's trying to process some of this broken down fat. But all those things go back to normal. So it shows how amazing our bodies are. One of the things that hasn't been tested, at least I could not find, which is what I find the most fascinating. And so if the slide that I have up right now has the fat cells in the middle and then kind of shows the hormones, the really common hormones and all the effects that they could possibly have.
That's another thing I just want to say, and you can go back to the other slide we were on. When I was going through training, they never talked about fat cells having any hormone connection besides leptin, right? That was the one that they found in the 90s.
1994. So leptin was 94.
Yeah.
And leptin and ghrelin isn't on this.
And ghrelin, too. Those were the 2 I remember from training. Other than that, now you have 12.
Oh, my goodness. And these are, again.
These are not even all of them.
No. So leptin and ghrelin are the 2 main controllers of appetite and satiation, essentially.
Oh, by the way, just looking at your slide, this resistin, I read an article on that once. So that was about insulin sensitivity,
Yeah.
and they thought that may have a big association with diabetes.
Yeah, and that's
But they don't know
exactly
the
what they
receptor.
see.
I mean, this is the problem with all this stuff. So
Right. And if you don't know what the receptor is,
then
it's
you
really
can't-
hard to
make a medication.
Right. And they've also found this is where the body is really smart. They thought that by injecting leptin into humans,
So
that they would lose weight.
What does leptin do, by the way?
Leptin regulates appetite. So leptin is like basically, telling you you're not hungry. Ghrelin, like think of it's a G, like grr, like you're hungry, like grr, I gotta eat. You're angry. Ghrelin, like yeah. See, this is what happens when you teach. To like yeah. Ghrelin. So ghrelin makes you hungry. Leptin like basically turns off the signal. Well, so they did all this research on animals again and found that if they injected leptin, that these mice would lose weight, they wouldn't eat. It'd be great, right? They thought this is awesome. Like
we found it.
Yes, and it
So
was
how
actually
much money
patented.
they must have invested so much money.
Millions of dollars were
Yeah.
spent on the patent for
And
leptin.
when they were investing, they're like, dude,
We found it. Yes.
they bought the boat, they
It
bought the
was
plane.
So highly contested too, because there were basically two labs working on it at the same time. It's a really fascinating study.
I
if
always
you're a
like.
geek
I think
me.
it's funny when you want to basically, was it trademark or what would you
Yeah.
call it? Trademark
Yep.
something that's already in the human body. But I guess if you can synthetically make it, I mean,
Mm-hmm. Well, so
I mean,
what
insulin's
happened?
in the human body, and people, people pay for insulin.
Yes, they do. Well, insulin also keeps people alive. So what happened, right? They injected leptin into a bunch of people and nothing happened
Nada.
because our bodies are smart and they also know to balance themselves. So you can inject a ton of leptin into somebody and if
Yeah.
your body already has enough, if all the receptors are full, sorry.
Matt Metz talked about
gonna
this.
go away.
I remember this.
Yeah.
In our episode on weight loss surgery.
Yeah.
Yeah.
So it's not that simple, and that's where the functions of fat as an organ in the body you really see it because it has these things need to go to somewhere. They need to be somewhere. Like things affect cells or
Right.
the fat
Just
cells.
giving a hormone and not understanding how it works and the receptors
Doesn't
does
do
not
anything.
equal action. Yeah.
No. So it's pretty fascinating. That's where I kind of think.
The weird part about fat is that this is something that when I was going through training, it was like no one ever talked about it. And now it's looking like it's more complicated than some of the more complicated organs in the body, right?
Yeah.
I mean, like I always think of something really complicated is like the kidney, right? And the kidney has so many different things, but this fat is turning out to be very, very complicated. So interesting.
Well, it's everywhere in the body. I mean, our brain is primarily made up of fat. Every single cell in our body, not just fat cells, every single cell has a phospholipid bilayer. Lipid is fat. So every cell in our entire body is basically covered in this little fat bubble, which is why I, as a nutritional therapist, talk so much about the quality of the fat you consume because
This is after the conversation about their last breath that they're going to die.
Yes.
And the running out of stem cells.
Yes. Well,
and then if your phospholipid layer happens to
It's
be
degraded.
deficient, you're going to die.
Well, you won't be very healthy. But you brought up
I
a
don't
great
like your
point.
scare tactics and the way you work with these patients.
So you brought up a good thing right there. We're talking about stem cells, and there's an interesting study that was done basically on cells and their viability after they were extracted. So they basically wanted to see if stem cells could still be alive after liposuction, or were they?
I mean, we didn't do it this talk because it would have been too long, but we should definitely do an episode on stem cells. Huge in the news right now. And to be honest with you, I think we know less about stem cells than we do fat.
Yeah, absolutely, we do.
Right.
Far less.
Right. So even though people will espouse that we do know a lot, I mean, we're getting there, but we're far, far from it. And that's why the FDA is stepping in on stem cells.
We also don't know the long-term effects of stem cell usage.
Right. And there's such amazing opportunity with stem cells. Like, I have a father with Parkinson's disease, and imagining that you could use stem cells to reverse Parkinson's disease and maybe even Alzheimer's. These are really prevalent, diseases in our country, and it's really costly for our healthcare system. But we're just so far from that. But it's exciting at the same time. I think we all need to take a breath and really start doing the research. You were talking about liposuction, so aspirating fat, sticking a cannula underneath your skin and sucking fat out, versus what?
So they did the study with liposuction or with a tummy tuck. So they basically did a
Versus-
lipectomy.
Right, taking the fat
Yep.
out, not traumatized by the sucking part. Okay.
Yeah. So then what they did was they took these extracted cells, and they have all their ways of making sure that the cells are still alive, and then they put them on an open wound essentially. So they put them in a hydrogel applied them to an open wound and then, watched how long it took the wounds to heal. So they had the ones without the control study had no stem cells put on at all, just the hydrogel. They had the abdominoplasty and they had the liposuction. So the full time for healing for the non-treated wound was 15 days. The cells from an abdominoplasty was 11. And the cells from it was 12. And then the cells from the liposuction was 13. So really only 2 days or 3 days at most were the benefit of adding these stem cells to wound healing. But if you think about that, I mean, that's a small controlled wound.
So that's 15 days, 2 or 3 days. I mean, that's 20%.
Right.
A 20% quicker time. Imagine how many what chronic wounds cost us in this country.
Yeah, that's what I was going to bring up was this was on a small control, they basically did a punch biopsy, a very small, not super deep wound. I mean, if you could increase the time it took or reduce the time by 20% that it took to heal a big, open wound from something necrotic. I mean, if you could heal that, it's so then I think oh my gosh, what about these women who've had a lot of liposuction? Have they just so kind of, put themselves back in time a little bit by reducing the amount of cells that they might have viable for these other treatments later in life? You don't know.
Yeah, I don't think so because now with the
you can grow. They can
you can grow
your
stem cells,
Yeah.
so you can culture them or however they do it, replicate them. So
feed them.
So interesting.
It is. So
we definitely have to do an episode on stem cells.
Yeah, and that most of the stem cells that at least are used commonly now, especially in this country, are extracted from your own adipose cells.
You could have cord blood stem cells, fetal stem cells, which are obviously not used for ethical reasons. So
or bone marrow. So the
bone
two,
marrow,
if you're using your own stem cells, so you probably don't have your own cord blood left, but your kids might if you stored their cord blood. But you yourself, at least people in our age group, probably don't have their own cord blood to use. So you're going to go to your fat and go to your bone marrow, essentially. And that's what most doctors now, at least in the anti-aging world, or some of these doctors that are using it for massive spinal injections, do a combination of adipocyte cells and also bone marrow. So they mix them.
Look at you, expert.
Well, I am by no means an expert, but it just kind of shows that this organ that we took for granted that most people kind of look at disparagingly and hate and want to go away and just spend a lot of time wishing was gone.
That's the point. It could end up being like our fountain of youth. It could end up being the answer to everything.
Yes.
This fat that we all hate could end up being the thing that is the answer to a lot of problems, including aging.
Right, but keeping your fat healthy is really key. As we've seen, fat can have very positive effects on the body, but there can also be negative things that come out of it.
We've talked about this. Fat stores stuff, and it can store toxins.
Can definitely store toxins.
Yeah, and sometimes people with weight loss can get this toxin release, and
feel really gross. Feel really bad.
Yeah.
Because you can store, your things that are fat soluble or fat storable, essentially. Your body can really store stuff away in fat cells and keep it there until the fat cells release everything. Let's say they are needing to shrink a lot. Right?
Yeah,
you're losing a lot of weight.
To get the contents out of the inside.
Yes, right. You got to clear out a cell. There's no room. Basically, you're moving from a 2-bedroom house to a studio. We got to clear some space. So, that stuff all
making the fat cell a millennial.
Yes. And just
no home ownership, just VRBO, everything.
Yes. So it's a fascinating thing to think about. There's so much to talk about here. I think the short answer is what happens to your fat when you have liposuction is we throw it out, but what happens to the fat left on your body is still kind of
big question mark.
Yeah.
I think we can say with a surety that it's not ultra negative, right?
No.
So it's probably a net zero.
Mm-hmm.
There's really no physiologic benefit, and if there is any physiologic negative, it's probably short-lived. So that makes Amy and I feel better because we do liposuction on a weekly basis.
Yeah.
And as we said, FYI, liposuction is not for people that are morbidly obese, or even obese. It's for people of fairly normal weight that have fat pockets they can't get rid of with normal exercise and diet. And that's a lot of people. We had a whole episode the last time on gynecomastia. Most of those patients have fat on their breasts, and they can be of extremely normal weight. Mm-hmm. That fat is not going away. It's hormonally driven. It's, based on their physiology, and liposuction is a great answer. So, liposuction is one of the one of the best things we do it in the office under local anesthesia with you awake in most cases, unless it's large areas. It's a great option for people, but it is really interesting. The next 10 to 20 years, I mean, we'll still be in practice. We're going to kind of see where this is going.
Absolutely. I mean, look at what's happened in the last 25 years with what we understand about fat. It's pretty amazing. So,
all right.
Thank you all so much for listening. If you are interested in this topic and think your friends would like to hear it, please share us with a friend.
Now that our podcast has grown, we should, pay the money and pay TLC to cut out with TLC music. Pay the copyrights on it.
Yeah, the royalties for that every time someone listens to our podcast. A lot. Yeah, a lot.
I'll call it T-Boz.
A lot. You and T-Boz are tight. So please like us, leave a comment, rate us, and review us. We can be found online on Instagram at Beauty and the Surgeon Podcast. Also on Instagram, that is Instagram at Beauty and the Surgeon Podcast. On YouTube, we're at Jason Martin, MD. And we're so glad you listened.
Yep.
Thank you so much.
We love your questions, and we've had multiple questions submitted. So some of the episodes coming up are going to be based on those questions. So thank you very much.
Thanks, everyone.